This is one of the most common questions that I get as a psychedelic therapist. A potential client reaches out. They're ready, they're willing, they're interested, they've read about it, and then they say, but I'm on an SSRI, I'm on an antidepressant. Can I still do psilocybin therapy? The short answer to this is yes. Yes, you can, but with some considerations, with some details that are important to think about. This is an area where outdated information is still circulating, where science has actually changed quite a bit in the last couple of years, and we're making the wrong assumption. Thinking the wrong thing could mean the difference between a transformative experience and a pretty disappointing one. Let's get into it. I'm Clayton Nickus. I'm a licensed therapist and the country's first fully licensed natural medicine clinical facilitator. Let's break down this issue of SSRIs and psilocybin. So first, let's get something out of the way. Not all antidepressants are the same, clearly, and not all of them interact with psilocybin in the same way. This is important because people hear antidepressants and you might assume that the rules are universal. They apply to all antidepressants, and they're just not. There are actually many different kinds of drugs that we would call antidepressants. So psilocybin works primarily through the serotonin receptor, specifically a serotonin receptor called the 5-HT2A receptor. That's a super nerdy thing. You don't necessarily have to know that. What's important to know is that the main site of action for psilocybin is the serotonin receptors. So when we're talking about drug interactions, what we really care about is, does the medication interfere with psilocybin's ability to bind to that specific serotonin receptor? So drugs like Wellbutrin, they work on norepinephrine and dopamine. They don't meaningfully interact with the serotonin system in the way that really matters here for psilocybin work. Wellbutrin is an antidepressant that doesn't compete with psilocybin for serotonin receptors. The pathways are totally different. There was a large survey study out of Johns Hopkins that looked exactly at this. What they said is that the probability of experiencing weakened psilocybin effects on Wellbutrin was only about 29%, compared to 47% for SSRIs and 55% for SNRIs. So what we know is that in practice, Wellbutrin, bupropion, is generally considered a non-issue. We typically don't worry about Wellbutrin in the system when we're preparing for a psilocybin experience. That's considered non-problematic. SSRIs and SNRIs, though, are a little bit different. It's a different conversation. These are medications like Zoloft, Lexapro, Prozac, Effexor, really common antidepressants that we see people prescribed all the time. This category of drugs does work on the serotonin system. It affects the availability of serotonin at the synapse by prohibiting reuptake. It's a fancy way of saying the serotonin tries to cross the synaptic gap. It's not accepted by the postsynaptic neuron, and it tries to go back to the presynaptic neuron, which we call reuptake. And the presynaptic neuron, the place from which the serotonin initially came, just says, no, I'm not going to allow that serotonin to go back in. And so it continues floating in the synaptic gap, making it available. That's a bunch of nerd speak. You don't really need to know that. You just need to know that SSRIs are supposed to work, although it's debatable that they do, by increasing the availability of serotonin at the synapse. So SSRIs influence the serotonin system, which is the same system that psychedelics use to create their magic. What that means is that SSRIs and SNRIs have a blunting effect on psilocybin, but it's an unpredictable blunting effect. We don't know the intensity with which an SSRI or an SNRI is going to blunt the experience. It could be 10%, it could be 80%. Some people on SSRIs report very little change in the psilocybin experience because of the medication. Others report that the experience is almost completely blunted, almost completely muted. And like I said, we don't have a good way to tell for whom that's going to happen for. It doesn't seem to necessarily be drug dependent. There's something going on here that we don't yet understand. And I certainly can't predict which category somebody's going to fall into. As a practitioner, I don't know if somebody who's on SSRIs is going to have 10% blunting or 90% blunting. I've administered psilocybin to people on SSRIs who seem to have had very little blunting. It's like they're getting the full experience of the medicine, of the psilocybin. I've also given psilocybin to people on SSRIs who experience really significant blunting, 40, 60, 80%. The experience that they expected to have just isn't what's actually happening. And you might be thinking, okay, so if I'm on SSRIs and the experience is just a little bit less intense, what's the problem? Is that really a big deal? It is. And this is why. So the research consistently shows that the efficacy, the therapeutic effectiveness of psilocybin-assisted therapy is related to the intensity of the subjective experience. So psychedelic intensity is related to therapeutic outcome. especially certain kinds of intensity. Mystical type experiences especially, which are the kinds of psychedelic experiences that are characterized by ego dissolution, a sense of universal connectedness, unity with internal things and external things, transcendence of time and space. Those kinds of psychedelic experiences have been repeatedly linked to better clinical outcomes. This doesn't mean that we want to dose as high as we possibly can in all situations. There's a ceiling to it. Just that if we want to have a therapeutic psilocybin experience, we do want to have the full psilocybin experience. We don't want anything that will blunt it or get in the way. So when we're talking about blunting from SSRIs, we're not talking about just a surface level kind of cosmetic issue. We're talking about a reduction in the very mechanism that makes psychedelic assisted therapy work, that makes it effective. If an SSRI is dampening someone's experience enough to prevent them from reaching those deeper states, we're probably going to be undermining the thing that we want to have happening. That's no good. We want to remove obstacles. We want to remove barriers to the full experience. That could include psychological and emotional barriers, not having the time, not having the space, not being willing to meet your internal experience or work with emotions and sensations. And it can also mean pharmacological barriers like SSRIs. So practically speaking, people on SSRIs have two options, two pathways forward if they do decide that they want to do psilocybin-assisted therapy. So option one is to taper off the medication in conjunction with a prescriber. This is not pharmaceutical medication management advice. Please don't take it as such. This is for informational purposes only. So tapering off medication means slowly reducing and eventually stopping SSRIs in conjunction with a prescriber. The last dose of an SSRI typically needs to be at least 2 weeks prior to the psilocybin dosing sessions in order to reduce the likelihood of blunting. And again, I want to be clear, this is not something that you do on your own. It's not. It's not something you rush. It's not something you just decide that you're going to do independently and you stop your medication. Please don't watch this video and stop taking your medication. That would be bad. SSRI discontinuation or withdrawal symptoms are very real. They can involve dizziness, irritability, brain zaps, flu-like symptoms. If you suddenly cease taking an SSRI medication, depression can get worse. Your life can become a lot more challenging if you don't do this in conjunction with a prescriber. So a slow and supervised taper, if that is the option, is essential. So option two, if you're on SSRIs, is actually to stay on your medication. There was an exploratory open label trial which gave patients a single 25 milligram dose of psilocybin. These are people who had treatment-resistant depression and who actually stayed on their SSRI throughout the psilocybin study. What this study found is that the therapeutic efficacy and the measurable subjective psychedelic effects, the trippiness of the psychedelic experience, and the efficacy of the treatment remained even though these people were on an SSRI. There was actually another randomized controlled trial which gave psilocybin to people while they were on Lexapro. What they found is that the Lexapro didn't significantly reduce the positive mood effects of the psilocybin, but it did decrease some of the negative effects like anxiety and adverse cardiovascular reactions. So you don't have to taper if that's not indicated, if it's not tolerable for you, if you feel like tapering is going to make your life significantly worse. For example, if your external circumstances can't support moving toward the challenge. One interesting thing here to note is that the process of tapering SSRIs can be a little bit like a psychedelic experience in that it can amplify your emotions, in that it can bring you into touch with psychological and emotional content that hasn't really been addressed or acknowledged. And that in and of itself could be good preparation for the psychedelic experience, increasing your capacity to relate to what's happening inside your mind and body. The SSRI thing, it's not so black and white. What I and other facilitators have observed in practice is that higher doses of psilocybin can actually sometimes break through even significant blunting because of SSRIs. This isn't something that, to my knowledge, has been studied in a formal and controlled way. It's clinical observation, but it is common practice in the field of psilocybin facilitators. If you do decide to stay on your medications, we can dose higher. We can give you a bigger dose of psilocybin that can break through the blunting, but we still want to have a conversation about expectation. The experience may be diminished. What I tell people is that if you choose to stay on your SSRI, there's a chance that the work is not as effective as you're hoping it to be, that it's not as impactful. And we can absolutely move forward with that. We just have to be clear. I want my clients to understand that there's some unpredictable, unknowable chance that if they choose to stay on their SSRIs, the psilocybin experience is significantly blunted. It's really important for all of us to understand that before going into a session. Now, I want to talk about one of the biggest fears somewhat informed people have about combining psilocybin and SSRIs, and that's serotonin syndrome. So serotonin syndrome is a dangerous condition, potentially lethal condition in some cases, that's caused by too much serotonergic activity in the brain. For a long time, serotonin syndrome was cited as a risk of combining psilocybin with SSRIs. We know that the risk of serotonin syndrome has been significantly overstated in the past, and we can prove it, both with experiential data from practice and with clinical trials. A 2022 pharmacology review evaluated the evidence and concluded that psilocybin carries the lowest risk for serotonin toxicity, both on its own and in combination with SSRIs. So according to this study, full clinical doses of psilocybin don't carry a risk for serotonin syndrome, whether you're on an SSRI or not. There was another systematic review in 2025 that looked at 18 studies on the combined use of antidepressants and classical psychedelics, and they found that there was no increased risk of serotonin syndrome, especially with psilocybin. And this is something that is backed up in practice. It's pretty common for facilitators to work with people who are on SSRIs, and it's not typically an issue. It's important to be precise about this, though. This applies to classic psychedelics like psilocybin, LSD, and NN-DMT on its own. Other substances, other psychedelics are a different story. And if you're on SSRIs, you don't want to just brazenly go and do any psychedelic that's available to you, because there are some that could be problematic, especially ayahuasca, which contains a MAOI, a monoamine oxidase inhibitor. That does carry some risk for serotonin syndrome for people who are on antidepressants. So no ayahuasca for people who are on SSRIs. MDMA is sort of similar. MDMA does have some risk for people who are on SSRIs. It requires more caution. But for psilocybin, the danger isn't that there's going to be some pharmacological reaction that's going to cause a health risk. The danger is not serotonin syndrome. The danger with psilocybin is reduced efficacy, blunting of effect. And there's one more piece I want to address about this, because it does come up in my practice and I don't think it's really talked about enough. Sometimes people who have been on SSRIs for many years, like 10, 15, 20 years, find that psilocybin's effects are blunted even after they fully tapered off medications. The theory for why this is that chronic, long-term, repeated use of SSRIs leads to semi-permanent downregulation of the serotonin receptor sites. Those are the receptor sites that psilocybin needs to work. So there seems to be some sort of lasting impact of SSRIs on the serotonin receptor when SSRIs have been taken for decades. And it's true. In research, antidepressants have been shown to reduce 5-HT2A receptor density with very prolonged use. And this downregulation may not be fully reversible. Again, in clinical practice, this blunting, even if it's because of downregulation of the receptor site, can sometimes be counteracted with a higher dose of psilocybin. And this is something that I and other facilitators have observed, rather than something that's been established in a controlled trial. But I have had successful psilocybin sessions with people who have been on SSRIs for 20 or 30 years by giving them a very high dose, much higher than normal. And even at that high dose, people who have been on SSRIs for 20 or 30 years might have sort of a middle of the road psilocybin experience, but that's better than nothing. But as is often the case with this work, the blunting effect is not predictable. So for people who have been on SSRIs for 20, 30 years, even 10 years, who decide to come off of it so that they can have a psilocybin experience, there needs to be an expectation conversation. I tell people in this situation, we can give it a try, but we might need to adjust and try again later. There's an opportunity in the session to titrate dose. Me and other facilitators typically start with an initial dose and then have the option for a booster dose. The booster dose can be especially helpful and important if we suspect that there might be some blunting. For example, if we give an initial dose and an hour and 20 minutes later, the person's not feeling anything, you're not actually having a psychedelic experience in the way that we might expect, that tells us that there could be significant blunting. And at that point, we can decide to administer a much higher dose. But even then, it's possible that we can't dose past the blunting. And it's important for people who are considering psilocybin-assisted therapy to know that. Occasionally, people who are on SSRIs come into psychedelic therapy already having had a psilocybin experience at some point in their life. And that's really useful because their history can tell us how they have reacted to psilocybin before they get into session. If they can tell us how much they've taken and what their experience is like, then that can be a way that we can sort of calibrate dose. So to summarize, if you're on an SSRI and you're considering psilocybin therapy, you have two options. Work in conjunction with your prescriber and your therapist or facilitator to slowly taper the medication so that you have a window of time between the end of the medication and the first dosing session of the psilocybin program, at least 2 to 3 weeks. Option 2 is to stay on your medication and kind of roll the dice, except that there might be some blunting, that blunting could be potentially counteracted with a booster dose in session and or a higher initial dose, but that it's unpredictable. It's not dangerous to do psilocybin-assisted therapy while you're on an SSRI. You just have to be willing to accept that there might be some blunting. That's all I've got for today. If you've made it this far, thank you for watching. Thank you for listening. Please subscribe if you found this helpful or interesting, and I'll see you next time.